What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? And guys, we're going back to basics and we're talking decontamination of probes. Whatever probe you may have, this is a vaginal probe, an endocavity probe, whatever you want to call it, abdominal probes, TE probes, whatever, rectal probes, whatever you call them. Please, 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 please refer to the IFUs. And why do I say so many pleases with the IFU? Probes are probably one of the few devices out there that the IFU is extremely broad. I think they almost validate every cleaner, disinfector, and sterilization process that is out there on the market. And the IFUs are very specific on probes, and I like that, and it gives you good choices. But do we know what the probe is used for is first on the list. Why do I ask that? Well, because the Spalding classification tells us how to further process these items. Now, I'm going to give my opinion. I believe probes or anything that touches the mucous membrane should be a critical item. No questions asked on that. The mucous membrane is considered a semi-critical item, and high-level disinfection is at best suggested. Sterilization, you can sterilize the item if the item can withstand sterilization, but at best, at lowest disinfection, it's high-level disinfection. Probes, I believe, should all be sterilized in some shape, form, or other. And I understand many of them can't. You know, they can't undergo the sterilization process. And that's another video for another time. But we're in decon here. And I want to ask the one question, too. Again, if you're reading your IFUs, do you believe that at point of use, they should be using some form of enzymatic spray to keep the item moist coming down? Again, we have to look at these IFUs. Can we use an enzymatic spray? Because I've seen places use enzymatic sprays on probes and they wind up damaging the probes. They'll spray the cords and the cords wind up getting tinted from the enzymatic, or they spray the connector box and cause corrosion in there. Because we can't get that enzymatic spray off there, so we wind up having to use some water, and then we cause further damage. So in my opinion, honestly, these probes should have a really good wipe down at point of use prior to getting sent down. A moist towel with sterile water is probably the greatest amount of moisture to use on there rather than a enzymatic spray. But again, refer to those IFUs. So this probe gets to decontamination. Very important not to get the connector box wet. So this should be off to the side. We're going to practice hand washing practices on our probes, as many IFUs do not allow the submersion of the probe or the cord itself. Definitely not the connector box. So again, check those IFUs. Can you use a detergent to clean it, a mild detergent, or does it just suggest some kind of disinfectant wipe / cleaner? Again, check with your IFUs of your device and your disinfectant / cleaner wipes if it has that capability. Is it a cleaner and a disinfectant wipe? Can it be used for both applications? And again, the IFU of the probe lists so many options. So, and again, check it out, see what it says. But if you can use a mild detergent, then you want to go ahead and grab a sponge or a towel, wipe the box off really good. Careful not to splash the connectors, so always on a downward angle away from you. Cleaning very good all around the box. Now this has a couple little set screws, so you might want to use a little brush to try to get in there to get any debris that might get jammed up in there, the little dirty hands and germs underneath the actual switch or controller, the locking switch. Again, there's a screw right there on the top. You want to get in that area as well too. Ditch the brush and go back to your sponge or your rag and pay very close attention to your cord. While you're cleaning it, you want to inspect for any damages. All right, so always run your hands over the cord. Make sure there's no damage. When you get down to the control body or the handle, you want to go ahead and pay special attention. And again, refer to those IFUs, the distal tip or the working end of the instrument. Can you use a brush on it? Many IFUs state not to do it because scratching that lens or that rubber piece interferes with the device and it can malfunction. So a soft brush or sponge to clean with your detergent. Next, you want to rinse, okay? So again, best practice is treated water. Again, refer to that IFU. You're not going to be spraying your instrumentation with water. You're going to be using a new sponge or a new towel with treated water, and you're going to wipe off the exterior. Again, making sure that the connector's facing down. A good wipe down around to get rid of that detergent or that cleaner. Go ahead and wipe down all the way down to the control body as well, making sure you're getting all that detergent off of it. So then the next step, what is it? So again, determine what the IFU states. The IFU may state that the actual cord can be low-level disinfectant with a low-level disinfectant intermediate wipe, and the body needs to be high-level disinfected or sterilized. So you have to determine that. So if it's just a cord that gets low-level disinfectant, you want to go ahead and grab your wipe. Okay, make sure your wipe is nice and saturated, and go ahead and wipe down your cord, making sure not to cross-contaminate or anything like that. Okay, all the way down to your connector. Again, making sure not to get the actual prongs wet, but you're gonna go ahead and wipe the switches off, the control body all the way around, and then go back with it again. If this is dry, grab another grab another wipe. Go ahead, and while you're cleaning, while you're disinfecting, go ahead and give this a wrap, right? Because now you're gonna pass it through to the prep and pack side, and we're gonna go ahead and further process this device. All right, guys, as always, stay true to yourselves. Keep it 100. Continue educating yourself. Until next time, peace.